Well, the addiction crisis is one of the cornerstones of Indiana University's Grand Challenges initiative. It's a program in which researchers are honing in on ways to increase quality of life for Hoosiers and also drive innovation. Another area of focus, climate change.
We're going to recognize the climate change is happening. These are the ways it's affecting us. And what are the things, what are the skills, what is the expertise, what are the resources and assets that IU can bring to the table?
That's the director of the Indiana University Resilience Institute, Janet McCabe, explaining IU's role in helping Hoosier communities maneuver through environmental changes to make the state's economy more resilient. Well, climate change, the addiction crisis, and providing precision health programs to Hoosiers all over the state, all part of IU's Grand Challenges initiative. It's a program that has evolved over the past 4 years. The goal is to utilize the talents of IU researchers to improve communities and the state's economy, as well as quality of life. For more on the Grand Challenges initiative, we're pleased to be joined, as always, by IU Vice President of Research, Fred Cate. As always, Fred, welcome to the program.
Thank you very much, Gary. It's a pleasure to be here.
You talk about research and the world-class research that continues to go on at IU, certainly with the Grand Challenges initiative, a lot of focus on the state's response to COVID, but also three specific areas and programs that have been launched over the last 4 years. Give us, for those who may not know, the Grand Challenges initiative and really what it's all about.
So the Grand Challenges initiative was adopted by the Board of Trustees as part of really the bicentennial plan for the university, as a way of really giving back to the state and demonstrating the impact that we try to have in the state. And it focused almost $300 million in three areas where we would make a particular impact working with partners across the state. And those three areas, as you mentioned, were precision health, dealing with environmental change, and responding to the addictions crisis. And in all three of those areas, what we've been trying to do is marshal the resources of the university, the entire university, so that you get a really holistic approach, working really closely with state and local government officials and with industry and with communities across the state to make a difference.
Well, give us an example, because I think, we hear a lot about research and what it means, and, the bottom line. I think the Grand Challenges initiative really is something that can and is making a difference in communities around the state. The addictions crisis, obviously, something that's gripped the entire state, in particular in rural areas. Talk about how the research connects with communities and how that piece of research is going.
Right, and let me say, we obviously think of all research as focused on making a difference. That, researchers don't do research just because they think it's interesting. But in this case, we were really focused on demonstrating that impact and being able to demonstrate it quickly, not having to wait 15 years or 20 years before we saw that impact. So, for example, we set up a new Alzheimer's clinic, funded in this case almost entirely by the NIH, an Alzheimer's treatment discovery center here in Indiana that's trying to provide new treatments for Alzheimer's, the nation's fastest growing and most debilitating disease, not just in Indiana, but across the entire country. And similarly, and when we deal with addictions, we've set up a pain assessment clinic that's trained over 1,400 people across the state in how to assess and treat pain in ways that don't rely on opioids. We have initiative in schools, working with school districts so that we can help kids not start using drugs. And then in our Prepared for Environmental Change initiative, we're working with farmers, we're working with communities, but we have an initiative underway, for example, to create a digital map, a model of the entire Wabash River Basin, that's 60% of the entire state, that will give predictions acre by acre for the amount of water that's available now and will be there for the next 75 years. So that, again, farmers can plan, cities can plan for their use of water and where that water is going to be and not be in the future.
Yeah, fascinating work being done. Do you sense, Fred, is this somewhat of a new model when you talk about research and really connecting with communities in the state and making an impact? Is this a new way of maybe doing things?
I think it is a new way, and I think it's a really important way, because it means not just getting results of research and taking them out to the public, something we've done for centuries, literally, but it means really engaging with communities when you're designing the research, making that research happen in schools and communities so that the benefit is felt immediately, and making sure that we are dealing with the real problems that communities face, not just those things we think are problems, but the things that state and government agencies, that other service providers are telling us, these are the critical issues, please help with these. And again, there's no better example than addictions. And in fact, we undertook the Responding to the Addictions Crisis Grand Challenge after the governor identified in his first State of the State address that addictions was one of the key focal points for his work. President McRobbie from Indiana University reached out the next day and said, we'd like to work with you on this, and we have ended up doing that initiative almost entirely in partnership with Governor Holcomb and with state agencies. Again, a tremendous example of how much more we can accomplish when we work together.
Only have 20 seconds left, Fred. A lot has been accomplished in these 4 years. What's next? I mean, as you look to the future.
Well, first of all, we're only about halfway through with these grand challenges. We have a lot more to do. We also, of course, have been very active in helping the state deal with COVID-19, and I'm afraid there's still going to be more to do there. And of course, this is, as you suggest, the model for the future. I think we'll be seeing more and more research like this where we work closely with our partners throughout the state.
Fascinating research going on at Indiana University. Fred Cate, the VP for Research at IU. Fred, always great to see you. Thanks for joining us.
Thank you very much.
All right.